Hey there, welcome back to How to Medicate and welcome to this new video on avoidant personality disorders, how to treat them and how to possibly improve them. This video is part of a video series on mental health problems, and for those of you wanting to keep on learning, check out the playlist in the description after watching this video, of course. Let me first introduce myself. My name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers. Because I believe that medically educated people make healthier decisions, which is the whole point of this video and this entire channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always ask your own doctor. And now quickly, let's start learning. Now, as promised, this video will discuss the best treatment options for an avoidant personality disorder, but before we do so, I thought it would be important to exactly discuss what an avoidant personality disorder is. Now, a avoidant personality disorder, also called an anxious personality disorder, is a group C personality disorder. It is characterized by severe social anxiety and avoidance of the sphere. Patients with an avoidant personality disorder consider themselves to be unappealing and avoid social interaction for the fear of being humiliated, ridiculed, or even rejected. Other symptoms might be a feeling of being inferior, an extreme sensitivity for criticism, fear of rejection, and avoidance of social interaction. An avoidant personality disorder is quite common, as it affects about 2.4% of the general population, being equally common among men and women. It's still unclear how an avoidant personality disorder is caused. However, it is believed to be caused by a combination of factors. Biological ones, like temperamental factors which are inherited, psychological factors, like experiencing emotional neglect in childhood and/or having anxiety disorders in childhood, and social factors like peer group rejection. Lastly, an avoidant personality disorder can co-occur with other mental health problems, a depression, anxiety disorders, other personality disorders, most commonly a dependent personality disorder, and obsessive-compulsive disorders. Which brings us to the possible treatment options. Here I want to mention that one of the most important factors in the treatment of an avoidant personality disorder is gaining a patient's trust. As patients with an avoidant personality disorder will often start to avoid treatment sessions if they fear rejection or distrust their therapist. Therefore, a primary goal in the treatment of an avoidant personality disorder is for a patient to challenge his own exaggerated negative thoughts about himself. When done correctly, treatment can achieve a significant improvement. There are several treatment forms which might be effective in the treatment of an avoidant personality disorder. Schema therapy, cognitive behavioral therapy, social skill training, and psychotherapy. Some of these can be done individually, while others are done in a group. This can gradually increase social contacts where social skills can be practiced. First of all, social skill training can help a patient to reduce the effects of an avoidant personality disorder in its life. Then it might be no surprise that behavioral therapy focuses on the behavior of a patient, in which difficult events out of normal daily life are practiced, so a patient can learn how to cope with these events. This can lead to new positive experiences. Next up, in psychotherapy, patients explore unconscious factors behind their feelings of inferiority. This can help to resolve conflicts from the past which might cause current problems. In addition, schema therapy is aimed at helping patients identify and understand patterns and coping mechanisms which they establish from their early childhood, to then modify these to change their behavior towards others. Lastly, there are no psychiatric drugs specifically approved in the treatment of an avoidant personality disorder. However, they can be used to treat co-occurrent conditions. As an example, a co-occurrent depression could be treated with antidepressants. Ultimately, it's best to discuss all these treatment options with your treating physician or your psychiatrist to discuss which ones might be most suitable for you. Now, I hope this video was helpful and I hope you know more now about the treatment of an avoidant personality disorder. If you have any questions, let me know in the comment section. And for those of you who want to keep on learning, check out the playlist in the description or up there. Thank you all for watching. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm on my way to 50,000 subscribers and you could help me. Now, before you go, I quickly wanted to thank all my sponsors on Patreon. Thank you Sebastian in particular, who is an Invested supporter, and thank all of you for watching. For those of you that are interested, I also made an Instagram account at How to Medicate. Check it out, and then as always, I will see you next week with a new video. Bye bye.